Gastroesophageal reflux disease is a condition in which the gastric fluid in the stomach moves backwards in the esophagus, which results in heartburn. When this heartburn continues repeatedly, it leads to gastroesophageal reflux disease. The main causes of gastroesophageal reflux disease are eating spicy foods, drinking alcohol, smoking, and excessive use of anti-inflammatory medicines. This disorder has 3 stages: mild, moderate, and severe. Nausea, sour taste in the mouth, regurgitation, burping, shortness of breath, and laryngitis are the main symptoms of gastroesophageal reflux disease. Moreover, this disease can be diagnosed by examining its symptoms and treating it using medicines. Surgery could be the foremost treatment if not cured. Let us explain in detail the causes, symptoms, diagnosis, treatment, and precautions of gastroesophageal reflux disease. What is meant by gastroesophageal reflux disease? Gastroesophageal reflux disease is a condition in which the acid of the stomach flows back into the esophagus, which is a tube connecting the mouth with the stomach. This backward flow of stomach acid irritates the lining of the esophagus. If this condition persists, the sphincter muscles at the bottom of the esophagus tube are weakened with time. The condition is also referred to as acid reflux. When acid reflux occurs repeatedly, the condition becomes a disorder, which is known as a gastroesophageal reflux disease. Acid reflux is like a burning condition of the chest, hence it is also called heartburn. Stages of gastroesophageal reflux disease. There are 3 main stages of gastroesophageal reflux disease. The first stage of this disease is a mild stage in which a person experiences heartburn and regurgitation happens once a week. The second stage is known as the moderate stage. The severity of the condition aggravates to the moderate stage when a person feels heartburn a few times a week. The third stage is called the severe stage, in which a person feels heartburn regularly and other symptoms such as chronic cough, hoarse voice, and regurgitation of food. Causes of gastroesophageal reflux disease. People experience heartburn occasionally without any leading cause, but it can worsen due to the following reasons: eating a spicy meal or extra sugar like chocolate, and drinking coffee, alcohol, or other similar habits. Smoking, obesity, stress, and anxiety are also the leading causes of gastroesophageal reflux disease. Additionally, during pregnancy or an increase in hormones like progesterone and estrogen, heartburn can worsen, thereby increasing the disease severity. The use of some anti-inflammatory medicines can also enhance acid reflux. Other leading causes of this disease are stomach ulcers and bacterial infection in the stomach or hiatus hernia, a condition in which the stomach moves upward from its position to the chest. Eating too much, late-night eating, excessive use of fatty or fried foods, and drinking certain beverages can also aggravate acid reflux. Symptoms associated with gastroesophageal reflux disease. The most common symptom of this disease is a fiery feeling in the chest, which we call heartburn, and a backwash of sour or bitter liquid in the mouth. This combination of heartburn and regurgitation is a widespread symptom. Some other symptoms include pain in the chest or upper part of the abdomen. A person with acid reflux feels difficulty swallowing anything, and this condition is known as dysphagia. Sore throat, coughing, breath shortage, and increased salivation are acid reflux symptoms related to the lungs or larynx. A person experiencing nighttime acid reflux could also face asthma and inflammation in the vocal cords, which leads to a hoarse voice. A person should visit their doctor if they experience these symptoms several times a week or their symptoms worsen, with difficulty swallowing anything. In addition to these symptoms, a person must also visit their doctor if they have serious signs of vomiting blood or unexplained weight loss. Diagnosis of gastroesophageal reflux disease. The doctor can examine this disease by taking a patient's medical history related to some common disease symptoms. However, to understand the severity and stage of this disease, doctors may recommend the following tests. Upper endoscopy. In this test, your doctor passes a thin tube through your mouth into the esophagus and inside your stomach. The endoscopy tube contains a camera and light in front to visualize the inner lining of the esophagus and stomach. As the tube passes through the esophagus to the stomach, it detects any inflammation in the esophagus, which may be attributed to the backward flow of stomach acid into the stomach. Stomach acid has an acid leach, which is unfavorable for the esophageal lining and thus may cause inflammation of the lining. Therefore, upper endoscopy can easily diagnose gastroesophageal reflux disease by detecting inflammation in the esophageal lining. Endoscopy is also used to check for the presence of ulcers and collect tissue samples from the stomach or the esophagus to test for any complications like Barrett's esophagus or other conditions, including the presence of infection, tumors, and ulcers. Probe test. This is also known as the ambulatory acid probe test. This test detects when and how exactly the stomach acid backflow occurs in the esophagus. In this process, a monitor that may be a catheter or a clip is placed in the esophagus to identify when exactly the stomach acid backflows. This monitor is connected to the computer at one end and is worn by the patient around the waist. X-ray. This test is recommended when a patient has a swallowing issue. Patients are advised to drink a particular type of barium whitish liquid, which coats and fills the inside portion of the digestive tract. This coating helps the doctor watch the silhouette of the esophagus and stomach. Esophageal manometry. The esophagus muscles exert force, which is measured by this test. The rhythmic muscle contraction is also measured by this test. Treatment. Surgery. Gastroesophageal disease can be controlled by medications, but if the medication does not work, then surgery may be recommended. Surgery can be done by fundoplication, in which the top of the stomach below the esophageal sphincter is wrapped to tighten the muscles and prevent acid reflux. This treatment requires minimal invasive procedures. Around the junction of the esophagus, small magnetic bead rings are wrapped. The beads are firm enough to close the junction but allow food to pass through. These magnetic beads, called Lynx devices, can be implanted by surgery. Medications for gastroesophageal reflux disease include antacid contains calcium carbonate that neutralizes the stomach acid, thereby providing quick relief. Histamine blockers include cimetidine and famotidine. H2 blockers decrease the acid production level in the stomach. Proton pump inhibitors are more potent than H2 blockers, and they are prescribed for a duration of 4 to 8 weeks, depending on how severe the acid reflux is. Precaution to avoid gastroesophageal disease. The main precautions against this disease are self-help measures, frequently eating meals with smaller portions, and avoiding any drink or food that may trigger this disease. Complications. If the gastroesophageal disease is not controlled or treated on time, it can lead to chronic inflammation of the esophagus. Esophagitis. It is a condition in which stomach acid eats or breaks the internal lining or tissues of the esophagus, causing inflammation, bleeding, and sometimes an open sore in the esophagus tube. This condition can cause pain or difficulty swallowing while eating. Esophageal stricture. Scar tissue is formed at the lower part of the esophagus when stomach acid breaks down its tissues. This extra scar tissue narrows the esophagus tube and creates a hurdle when food passes, leading to swallowing problems. Barrett's esophagus. Some changes occur at the lower portion of the esophagus due to stomach acid, which can lead to esophageal cancer. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.